right, I'd like to welcome everyone to our Finance Committee meeting of the Cook County Health and Hospital System. Pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. So to streamline, we've combined the action items into one combined motion. So we will only need to take one roll call vote during the meeting. Of course, there can always be a departure from that if a separate issue arises at some point afterwards. Anyway, meetings of the Cook County Board of Directors, the county of the will continue, or we're expected to meet remotely until we've decided that it is safe and appropriate to do it in person. Will the secretary please call the roll?
Director Deere?
Deere is here.
Director Harrington?
Present.
Director Mhnu? Director Mhnu?
I heard him.
Present.
He said present.
Oh, thank you. Director Story?
Present.
Chair Ryder?
Here.
And for the record, those directors also present. Director Guggenheim?
Here.
And Director Ketting?
Present.
You have a quorum.
All right. Thank you, Debbie. Debbie, is there any public testimony?
No, we did not receive any.
All right. Excuse me. Next on the agenda is the April 21st, 2022 Finance Committee meeting minutes. These were approved by the board at the April meeting, but are being presented for the committee's review and discussion if necessary. Does anyone have any corrections or changes to the April Finance Committee meeting minutes? Any corrections or changes? Any corrections or changes? Hearing none, we will hold the adoption of the April 21st, 2022 Finance Committee meeting minutes to the combined motion that we will hold later in the meeting. Next on the agenda is items under the Chief Procurement Officer. We're going to have a series of procurements presented, contracts presented, including the grant, the grant items and items for county care. We're going to structure it so that either Dr. Joshi or Dr. Rubin will present items 1 through 5. Aaron will do 6 through 7, and then Charles will round us out. So do we have one of our esteemed public health people to take us through the first 5 grant related items?
We sure do. Good morning, directors. Happy to do this. So the apologies. The first contract here is with Health and Medicine Policy Research Group. This contract is to provide training assistance and technical assistance to CCDPH for trauma-informed care. That is essentially a way of approaching patients and colleagues in a way that is compassionate. Fundamentally, that's what it is. CCDPH was charged in the last strategic plan with essentially training all of CCH, exploring ways to train all of CCH in trauma-informed care. And this is sort of a contract that will help us do that work. Next contract, please. Okay. I believe this is it. Sorry, I'm having a hard time seeing the screen here. Over scrolling. Thank you. Sorry. This is a contract with RTI International. RTI is a internationally known public health research institution, and they are contracted with us to conduct a BRFSS. A BRFSS is a Behavioral Risk Factor Surveillance System survey that essentially collects information about behaviors such as smoking, for which we want really targeted data at the municipal.
Uh-oh. Did we lose Karen?
Dr. Joshi? He's still, Dr. Joshi?
Yeah, he
He's still
seems to have
visible as an
dropped.
attendee.
Yeah, this is Dr.
I'm sorry, Dr. Rubin, go ahead.
Maybe I'll carry on until he can reconnect. So yes, this is, as we see here, RTI is mentioned, has a contract currently with the city of Chicago and CDPH to conduct a health community survey. And the suburban area, we have been remiss, or I wouldn't say remiss, we have not had the resources until now to conduct the same type of survey with the same level of scrutiny and reach as the city has. And so this is one of the vendors that now is going to help us do this. It's connected to a national survey, and so that people use throughout the entire country, organizations for health and public health data. So as you can see, this particular contract is to give incentives for participants to cooperate with the survey and to agree to be administered the survey. And it's sole source because this is basically the only group that does this. Next is the vendor is, oh, Don Bolger. Yes. Mr. Bolger has been on contract with us since I think it was November of 2020, working on our communications team. Since our current manager of communications has left the organization, Don has had to step in and to function as our PIO, our Public Information Officer for the Health Department. And we are obviously required to have that. So we are going to be putting out an RFQ. I'm sorry, we are right now actually trying to put forth, we have already put in the request to hire for the replacement of our communications manager, and we want to extend Don's contract for an extra 6 months to allow us time to hire the replacement for our communications manager, who would then take on the role of the PIO. Next. And this one is BCT. Similarly, BCT has been working as our main, wait, this says, it's a, yes, right, I saw something there about naloxone, that's why I was a little confused. But anyway, yes, they are the main vendor that helps support our website development and maintenance. We are putting out an RFQ, or an RFP actually, and it's in the process, and it hopefully will be posted. It has been posted. Hopefully, it will be coming down soon, and we will. And it could be that this vendor BCT will win the contract. If not, we will go with somebody else. So this is just to extend us so that we don't have a gap of service in supporting our website for just 3 months. And this one, behavioral health landscape. Yes. This is with Health and Medicine Policy Research Group. They have helped us and continue to help us with, especially since we are building out our behavioral health work in the clinical as well as public health frame. Health and Medicine Policy Research Group has been contracted to give us more of a community-wide, suburban-wide landscape on the state of behavioral health in order to inform our project going ahead. And this is up to not to exceed $13,000. And I think that's it for me. Thank you.
Mr. Chairman, can I just comment? I'd just like to comment for the historical record on the first grant award to the Health and Medicine Policy Research Group to train some of the Cook County staff in trauma-informed care. And for those of you who are too young to remember, Cook County was in fact where trauma-informed care was essentially invented. And for many years, an amazing physician called Carol Wachowski, who was triply boarded in internal medicine, emergency medicine, and psychiatry, trained every single person coming through all the training programs in internal medicine, psychiatry, and emergency medicine in how to deliver trauma-informed care. It seems to me ironic. Carol was actually for many years the member of the Health and Medicine Policy Research Group. So her passion for this important aspect of bedside care was widened and promulgated, I mean, actually throughout the country. I mean, she's an amazing trailblazing figure in this whole field, and it all started at Cook County. Does anybody on the call remember her and know about this training that happened?
No,
Yeah,
but
this
thank you
is
so
Dr.
much for
Rubin.
that
I
historical
certainly do.
context.
Yeah, well, I just wanted to sort of say that because it's, you know, she was really a sort of hugely important national figure in bringing this to the attention of the entire field. I mean, I was in my 60s before anyone ever doing a medical screen on me asked me if there was violence in my life and did I have to deal with domestic violence or any other form of violence or trauma. And this was entirely due to the fact that this system of screening everybody in the emergency room for domestic violence and other forms of trauma got into the sort of routine care protocol.
I think Rachel was commenting that she remembered
Okay.
as well.
Okay, great.
Yeah, I remember her as well,
Right.
very well.
Okay.
Well,
That's
thank
all.
you.
Thank you.
Thank you, Mary. So moving to the next set of procurement items, I'm going to ask Aaron if he wants to pick up the ball and go with the county care items.
Hi, good morning. Aaron Gleaner. I'm interim CEO with Health Plan Services. So the item before you here is for Vital Data Technology, which is our HEDIS software vendor that provides all of our HEDIS data to the state, as well as provides dashboards and information to our providers, as well as performs the chart chase and abstraction activities. And this is the first of 2 one-year renewal options that we're exercising.
All right, go ahead.
And then the next item is for the Chrysalis group, which is the behavioral health crisis call line. This is a state mandated contract. So the state mandates for all Medicaid health plans that they have to use this vendor. So this extension request is just aligning the term of that contract to the same term of our contract with the state. So through 12/31/2025, which is when our current contract with the state ends.
All right. Aaron?
And
I think we're ready for Mr. Jones.
Oh, Sorry.
And I do not see, oh, there he is. Charles, are you here?
Yes, I'm ready.
Charles?
Yeah, I was just.
All right, Charles. Rock and roll.
All right. Good morning, Charles Jones, Chief Procurement Officer for Cook County Health. So inclusive of the 7 contracts that was presented to you by Dr. Shoshi and Rubin and Mr. Galena, we have 23 contracts total. All 23 require a responsive letter from the Office of Contract Compliance. We have 5 back and there's 18 outstanding. However, we see no issues that happen with those. Request 8 here is to increase the contract with Biosense Webster for disposables for the Cartos 3 system and capital equipment that we have in-house within the cardiology department. $1 million FY22 impact, 1.5 million total increase for the remainder of the contract period. We've hired within the EP lab another physician, which is yield 42% increase in capacity, so thereby requiring the increase of purchase for disposables.
Okay.
Request 9. This is a request to increase the contract with Bobby E. Wright Comprehensive Behavioral Health Center for mobile crisis outreach teams, $145,000 FY22 impact that is grant funded. The vendor will continue to act as the lead for the safety and justice challenge diversion strategy, provide support to our mobile crisis team, and work with the Chicago Police Department to coordinate proactive outreach efforts, thereby keeping individuals from going to jail and going straight to mental health assistance.
Quick question, Charles.
Yes, sir.
Can you just tell me how long this contract has been in effect?
This contract started on September 30th, 2018. So, and it was awarded for 48 months and it goes to October this year. So we're still in the original contract period.
So the original contract period is 2018, 9/30/2018. Thank you.
Yes, the commencement. You're welcome. Request 10. To execute a contract with Imperial Lighting Maintenance for light maintenance, replacement, and repair of all our ACHN health centers. This is a zero physical impact as we're doing a time-on extension for exercise and a second renewal option for the contract. Request 11. Extend and increase the contract with MHN. I'm sorry, is there a question for Ken?
Yeah, Charles, just give me 1 second, because this is, since we have you in the chair now, this will be the first sole source that you're presenting on, and we've had some sole sources that have come up earlier. I just want to make sure, on the front end of the conversation, we have a bunch of sole source contracts today. Sole source contracts come to us in a variety of different ways. Contracts expire, but we don't have the RFP ready. There's some companies vendors that we do business with that have proprietary products that there is no other available. But talking to Israel, our CEO, Mr. Rocha, we talked about, because over a number of years we've always had a conversation around is there a better way to deal with timeline issues and also the exploration of other options when we're in a situation where we're dealing with proprietary products from the incumbent vendor. So as I think many of you may recall, this committee and the board approved the contract with Deloitte to help us do a full review of our procurement, in dealing with the, way to cut down on our sole source contracts as a whole, or at least create a better process to handle that. And I don't know, Israel, if you wanna jump in and explain where we're at in terms of scaling that up right now.
Sure. Thank you so much, Chairman Ryder. Yes, we are in the process of onboarding Deloitte to help us to restructure our procurement department to be a best-in-class department and utilize enhanced software and better structure that would allow us to be more responsive, to make sure that we are utilizing the latest processes and ensuring that the board is briefed and that our contracts are timely and in advance, so that we can ensure that we are going to market timely, sharing the information timely, and ensuring full opportunity for all qualified vendors to be able to apply timely with our products, and also have an education process that would allow even more people to be able to compete for our services, creating a more robust effort and hopefully better savings and efficiency and scale in our processes. And so we look forward to that. As you have seen some of the changes today, we're even starting to have our service line leads who have more of that information available, present the contract so that they can be able to make sure are available to you to ask those questions. And you should be seeing some further enhancements as we continue to improve, like most organizations, our procurement processes and our overall operations as an organization.
Which again is why Dr. Karen and Joshi and Mr. Gleaner presented on their items before getting to Charles. So we've already approved the Deloitte contract, so we don't need to, we don't need to go back and deal with that. I just wanted to raise it now because we had Charles here, and we've had a number of sole source that we've already reviewed today. And so Director Story, I see you have your hand raised.
Thank you, Mr. Chairman. I'm grateful to hear CEO Roach's comments about Deloitte and our procurement process, because I have been extremely concerned about the number of sole source contracts that's presented to this board, and in particular to the Finance Committee, and asking for us to approve something which I am concerned about whether they've been fully vetted in the marketplace. And obviously, if they're sole source, they obviously have not. So I think this is a good step forward.
Otis, that you just made a pretty broad statement there. I would say that we have a sole source issue. If the fact that we have a sole source contract doesn't mean that it hasn't been properly vetted in the marketplace. I would just caution you on that.
Okay, thank you. I would accept that. I would accept that. But the Chairman, my concern is the fact that the number of sole source contracts, and the fact that in my opinion, the lack of what I perceive as lack of due diligence in this process. So, like I said, I appreciate the fact that we have an engagement. We have engaged Deloitte to try to address this issue, because I think it's one that's probably been long overdue. That's my point.
Yeah.
And it's something that is necessary. I just personally, for Otis Story, I just don't feel comfortable with the number and what I perceive is the lack of due diligence on the part of management in bringing contracts before this board, because I take seriously my responsibility.
The number. Yep. Thanks, Otis. I would just reflect on, my time on the board. We've had, there's been a lot of sole source contracts that we've scrutinized over the years that have come at a steady pace. Some of it relates to timing, some of it relates to whatever, to proprietary equipment, products and stuff like that. I will say that the current management has been all over this, and that's why, when we talk about Deloitte, it's something we've already acted on, and that this management presented to us, and we've now we've now acted on. So I was, just to remind folks that we are in process of dealing with the sole source issue in a way that we haven't in the past. I can't, I see Joe's hands up. Joe, go ahead.
Director Kedding's hand was up before mine. I would defer to him if he still has a question or comment.
No, I decided to skip it.
Okay. My suggestion would be if we're moving in that direction at some point, could we get some information that shows that we are addressing it? I know we've identified someone to consult with, but maybe they could put in place some kind of reporting back to the board to show what the trend is and how we're getting on top of this moving forward.
Yeah, so I will say, and Israel can speak to this if he wants, that we plan on having a briefing on the process that we're engaging in and the progress we intend on making, but we are still on the front end of it. So I would just say stay tuned, and that is absolutely being planned for. Israel, do you have anything to add?
Sure. What I would add is that is part of the process, but I would also say to the board, you're seeing some of those changes now with the reporting structure changing, the contracts changing, having more due diligence here, some going to the board with deeper value and larger constructs. And that process has been done ongoing for the last 18 months that we've been working on doing this. And so we are working on improving and streamlining our processes, getting things together to make sure that we're best in class. Healthcare has often struggled with sole source contracts as a general industry because at times there is only one vendor that has been approved by the FDA for the market. And so you have difficult choices in what you can do to ensure that you're getting supplies and products. However, that does not apply across the board. And so we want to make sure that where possible, we are doing everything possible to exhaust the ability to bring in vendors and ensure savings and efficiency and be good stewards of our resources. And where that is not possible, that we are still utilizing and exploring other ways to ensure processes come forward. And that's really why we wanted to get someone to help us get the best in process class. Due diligence does occur. We have legal review processes, things that happen, and the board is the due diligence who's approving these contracts and has been through the process. So we are working together as a team to make sure that we enhance it. This process now that we're going through, where they're presented and approved and discussed at the board level, is how we ensure the judiciary and the accountability of that. We will make sure that we are disclosing the processes, the percentage of RFPs, what were the contracts, and at every single one, like you had before you, there's a justification, contract compliance, and legal has to sign off on believing whether or not this is illegitimate and sole source. So I don't want there to be an appearance that at some point any of those processes were diverted, because they were not. Legal has to sign off, contract compliance has to sign off, the board has to approve, and we have to meet the justifications required by both the county and state procurement codes, and those have been there. But there is always opportunities for improvement. There's always opportunities for better disclosure and communication, and always better opportunities to bring in best practices so that we can have a state-of-the-art process that has the most inclusive and the process that yield to the greatest savings and opportunities for our patients. And we're excited to be moving in that direction, and we'll be more than happy to be bringing reports back to the board so that they can feel comfortable that these processes of governance are in place.
Any other questions before Mike? Your hand either up again or still
I'm up again. I can't make up my mind, but I decided I don't want to gainsay anything that anybody's said to this point. I merely want to add one countervailing note of caution, and that is that the healthcare institution does not exist for the state for the purpose of making contracts. Those are pursuant to other goals. And we always need to remember that while maintaining public trust as a public institution, very, very important, that conducting contracting processes as an end in themselves is not without its own expense. And it takes a lot of time to conduct a good contracting process. And so periodically, sole source contract really is long-term efficient. And typically, we don't have the metrics that capture those efficiencies, as well as we have metrics for capturing other kinds of efficiencies. So like everything else, it's kind of a management balance, but I just did want to put that one little note of caution as we are being concerned about sole source contracts. Sometimes they are the most efficient.
Yeah, I've agreed, and that goes to my comment earlier. They're not inherently defective or evil. There's plenty of reasons where there's plenty. I think that making sure that everything is vetted is important, but there's absolutely appropriate times for sole source contracts. And I've said a couple times, this change is something was already started. So and as having been chair of this committee for a number of years at this point, I'm guessing, Debbie, what do you think? 6, 7 years? I don't know.
Can you repeat the
I have
question?
no idea. How long have I been chair of this committee? Do you remember? A long time, right?
A long time.
Yeah, that's just called a long time.
Okay. Long time. 4 or 5 years, probably. I appreciate and grateful for the CEO and management really taking this one by the horns, because it was something we struggled with previous folks. So I'm very happy. So, on behalf of the committee, thank you, Israel, and your team for continuing to push in this direction. I'm gonna hand it back off. I'm gonna hand it back to Charles to now present the MHNU contract.
Thank you, Chair Ryder. With that being said, for MHNU, I'd like to call Ileana Moore, the Chief Administrative Officer for Ambulatory Services, to present this to you.
Morning, directors. This is Ileana. I am presenting the MHNU contract. The purpose of the contract is to provide us a e-consult, which is services that connect 25 FQHCs through over 100 different locations, referring us specialty as well as testing. The product is used in 2 forms. One of the forms is that they provide a note to our specialist asking for a consult. Our specialists review that consult and determine, 1, can they provide direction to the PCP so the patient can be managed by the PCP with direction of the specialist? Or 2, does that referral merit a in-person visit? The specialist then does those 2 things for the patients that they believe can be managed, and they provide direction, and that provides us an opportunity to avoid an unnecessary specialty visit, which then benefits county care utilization and also keeps our access open for the patients that really need to be seen in person. The second option, as I stated, the specialist reviews the consult and makes a determination that the patient indeed needs to be seen, and the patient is then scheduled. That is one of the primary purposes of e-consult. The second is that it is the vehicle by which Canary, a vendor, sends digital images for retinopathy for patients that are home. And those images are sent to our ophthalmology team, who review it in the same way. For those that need to come in, appointments are then made. So that is the purpose of this product. And again, it provides us referrals into our specialty and for tests as well. In the briefings earlier this week, it had been discussed to move see if this contract we could extend through May of 2023, because our plan is to have an RFP for the solution that eConsult provides us. And so we can see what other vendors in the market are able to provide this service, and therefore had considered having this contract go through May 2023. After consideration and discussion internally in terms of just looking at the timeline for the RFP, determination was made to keep it at the current time and not need for an extension. So this contract will allow us to continue those services and continue care to the patients, as well as concurrently, we will run a RFP for this service during this contract period.
Great, thanks. Thank you, Ileana. Are there any questions? All right. I'm not hearing any unless I'm not seeing.
I have a question. This is Commissioner Deere. I have a question. So thank you first and foremost, thank you so much, Ileana, for doing such a yogi job and making sure that we are aware of the contract and what's going on with it. I appreciate the status update. I appreciate you availing yourself when needed after hours. Nobody has to do that, but you are committed and passionate to your job. So thank you. I know we don't, there's not a lot of thank yous that go around, but I'm saying thank you. So I appreciate you for that. So this particular, I'm sorry.
No, go ahead, Commissioner Deere. Thank you.
This organization, I think, has, as you've indicated, done a good amount of work, and there is a value add. So it's not about this organization. I, as some of our other board members have indicated, do have an issue when we are extending contracts and not putting this out for RFP. And so we've done that a few times already. And at some point, we have to stay competitive and make sure that if there are other people out there that do this work, that they have an opportunity to bid on it as well. I know that there are probably other people, other minorities who may be interested, et cetera. And so that's why we have the procurement and competitive process. Hearing that we were trying to move it to May 2023, I think that's a bit much of an extension. You know, I would be recommending that we start working on an RFP.
We're not doing that though, Dennis.
Okay.
That was what Ileana said, was that there was discussion that some had suggested doing that coming up at the briefings, and management decided not to do that. And this contract only is for the period ending January 31st, 2023. So we're going to be continuing services.
When does it end though? What are we extending services to now?
We're extending it to January 31st of 2023, which should give us time with our procurement timeline. That should give us time to go out to market, you know, review and score the bids, and then come back to committee to then move to approval. I mean,
okay,
and by the way, that's a tight timeline. So
it's a tight timeline.
It seems like
it is.
Yeah, that's a very tight timeline.
Thank you for that correction. Thank you for that correction, Mr. Chair. I stand corrected on that, and certainly that's what I would be interested in, leaving it where it is now and going and beginning to prepare for an RFP as quickly as possible, so that, you know, if other individuals have an opportunity, they can bid on it as well. Thank you.
Otis?
Yes, Chairman. I'm not clear on what we are talking. I don't know if I'm not in sync with what the timeline is here. I thought Ileana's, this is my interpretation of what she said, that Going forward, as of today, they will start an RFP process. So what we're voting on is an extension of the current contract to give her the opportunity to go to market and make a determination about a permanent or long-term contract for e-commerce services going forward, not to wait 18 months. January 23 puts us out. January 1, 23 puts us out about 8 months, 7 months. Is she saying that she needs that much time? Is that what we're saying?
I think that in order, you need that much time, plus you have to have a reasonable contract period. But yeah, if you know, with
So
the way
next 8 to 7 months to conclude this process.
Mr. Chair, do we have anybody that can explain that procurement process? So that
hang on, guys. We've all been doing this a long time. I'm happy to bring people up here to explain how our contract extensions go and when we have to go out for RFP. But this is a normal course. If anyone is familiar with how procurement works in government, we don't walk out of the room, write something up, send it out. There's a lot of notice, and then that goes out. We first send. We have to put the RFP out to the public after it's written. Then we have to wait a certain period for responses. We get responses. There's an evaluation of all the responses. After the evaluation of the responses, procurement starts talking to the vendor to zero in more on details. So, having been through procurement and a number of public bodies, I mean, I think 7 months is pretty aggressive. Most of the, any range that I've ever seen on the short end for us to do something like this or any other public body is usually a 6-month extension at the bare minimum, and then usually up to 12 months. 12 months is usually, I'm guessing, the reason why someone suggested 12 months is that's usually the more prudent thing to do for the people who actually work in procurement to get all the work done, because they're also not going out on RFP on one contract. We're going to have multiple contracts going out. Ileana and the procurement people are managing a bunch of other processes. So let's not belabor something that we already have familiarity with in terms of how extensive going out on an extension and an RFP is.
Thank you for that overview, Mr. Chairman. But my question is a very simple one. Is Eliana asking for an extension of this current contract to January 1, 23 to give her and her team enough time to conclude a definitive RFP process? That's 7 months. That's all I'm asking.
She's January 31st. She answered that question, Otis, right before you asked your second question, which was to walk through it all. She said yes.
Okay, so we're talking about an 8-month process.
Yeah, roughly.
Okay, so that's my question. Simply that this is an extension for 8 months to give her and her team to conclude her process.
Right, and the reason why it's a sole source versus an extension is because we don't have any other extensions built into the current contract.
I support the 8 months extension. I have no problem with that. I was seeking, just wanted to make sure the timeline that I heard was 7 to 8 months extension.
Yep.
Thanks for that clarification, Mr. Chair.
Not a problem. Any other questions on the substance of the contract? I'm not hearing any. Ileana, I don't know if you have another one to present, or Charles, we're going back to you for for the next one?
It should come back to me, Chair.
All right. I'm still getting used to the new process where we're doing multiple handoffs. So just bear with me.
That's all right. You did a great job. Number 12, extend and increase the contract with GRM Information Management Services. This is our offsite central storage for our medical records and all records as well. $240,000 fiscal impact for 2022, $420,000, $480,000 total for this 12-month extension. We will, just like we're talking about MHN, within the fourth quarter of this year, FY22, we will go out with an RFP for a new award. And again, this vendor system-wide with all our records. Request 13. Extend and increase the contract with Solomon Solutions for professional consultant services and area of supply chain management, materials management, finance, and CCDPH with grant funding work within my department as well, supply chain management. $313,000 increase with this this fiscal year impact. They would continue to provide vital resources on a temporary basis to complete the final transition of work and resources to provide it to support our system, our data, and our inventory management. 3-month extension here, an increase. Vendor is a certified county WBE. 14, extend and increase the contract with Anchor Mechanical for HVAC services and repair for all our ambulatory health centers as well. $111,000 FY22 impact, $266,000 for the 12-month extension. This is exercising the second 1-year renewal option within the contract. $15, extend and increase the contract with Calumet City Plumbing maintenance and backflow inspections as well for our standalone ambulatory health centers throughout the Chicagoland. Exercising a second and final 1-year renewal option of that contract, $30,000 total impact, 12-month extension. Request 16, amend, extend, and increase the contract with specialty consultants for environmental assessment at Oak Forest campus, the administration building here on the campus of Soldier, Forest Park, TB Clinic, and Providence Hospital, $36,000 and a 12-month extension. This is obviously a small dollar amount, less than the amount you normally would see, but with all the extensions and amendments we've done before underneath the CPO's authority and the CEO's authority, we've exhausted our authority. So therefore, this comes to you for approval. It is the first of 2 renewal options for the contract. And Department of Capital Planning and Policy will fund this as a CIP. For request number 17, new contract with Rest Publica Group, I'd like to call upon Ms. Karen Stanzik, the Chief Marketing and Communication Officer, to present it to you.
Thank you, Charles. Good morning, Directors. Karen Stanzik, Chief Communications and Marketing Officer for the Health System and the Health Plan. Before you today is a request from myself and Erin Galiner to enter into a contract for comprehensive marketing communication services for the Health System and the Health Plan. The contract dollars will be divided equally between the Health System's budget and the Health Plan's budget and will allow us to increase our market presence in the coming years. The RFP process commenced last fall, and we received 5 proposals. The evaluation committee, led by Supply Chain Management, reviewed the proposals and is recommending a contract be awarded to Res Publica Group. So to summarize, today's request is to enter into a 3-year contract with 3 1-year options with Res Publica Group. Be happy to answer any questions.
Any questions?
Mr. Chair. I have a question, Mr. Chair. Commissioner
go ahead. Yep.
Thank you so much, Ms. Stanzik. Thank you so much, Ms. Stanzik, for the report. A couple questions I have. We are meeting our goals as it relates to minority and women business with this particular extension of the contract or this particular contract.
Yes, this team brought a full compliance with the goals as well as certified MeBe-Weebies.
All right, good, fantastic. And then do we know what percentage? I can't see it on the screen. Do we know what percentage we're at? Was it 25%? Is it 35%?
No, it's 35. It's the full goal.
Good.
And
good.
I will note that we have always met or exceeded the goal on marketing contracts.
I'm glad to hear it. I do understand that this is the vendor that we had been working with prior to, correct?
That is correct.
And they did receive some awards or something like that. I remember reading in the paper some stuff.
We have, yes, Commissioner, you're correct. For the marketing campaigns for COVID, we have received, I think we're up to 11 separate awards, all national awards.
Good, good. I'm glad that they've done an excellent job. I certainly would love it, Mr. Chair and CEO Roca, when we have contracts like this that are meeting their goals and all of that good stuff. I certainly want to highlight them, but I also want to have a much larger conversation. And this is not the context for it because this group is doing an excellent job. But when we have dollars that are geared towards COVID, I think it makes sense because the Black and brown communities were hit so hard by this that, you know, there are opportunities that are given directly to what did Karen Stanzik called it, MB-Weebie, the MB-Weebie. I like that. That we give those opportunities directly. And the hope is that those who are MBE, WBE on this contract, we can begin establishing some mentor-protege relationships so that we can build and grow these companies, because we know that those small companies are the backbone of not only America, but those underserved communities that they represent. I yield back.
Yeah. Commissioner, let me just add one thing. Thank you for that. I do want to add that on the COVID, on the Trust Us campaign, which was about $4.2 million, if I remember, almost 90% of that went to MeBe-Weebies to address exactly what you just pointed out.
I'm impressed. Can you send me some information on that?
I would be happy to do that.
Thank you so much. I yield back.
Yeah, Dennis, I would just point out that we don't need to limit it to COVID, and in fact, we don't. I think Charles works his ass off, for lack of a better way to say it, to maximize the MeBe-Weebie, and that's since we're using that term, participation, and wherever we can, we exceed the goals, and we actively do recruitment. And Charles will give his report on MBE, WBE metrics here in a little bit. It's a function of having the opportunity to work with MeBe-Weebie vendors, and our vendor fairs, and what a particular market looks like. So
I agree, Mr. Chair.
I don't know,
but I want to be clear on what my point was. It was everything that you said, but a little bit more. I would like to see us have a goal of building these MeBe-Weebies up so that they become the primes. I'd like to see Cook County Health and to begin, creating scenarios where we can directly, contract with them. So I think we have.
What I'm saying, Dennis, is that's already the goal. And what I'm saying is that's already the goal.
Thank you. Thank you. I appreciate it. We're on the same page.
Yep. Yep. Joe?
Yeah, I have a concern. My concern is the actual cost of the contract. It's 2.5 times more than we were paying in the past, and I'm trying to figure out why the costs have gone up so much, and what are they going to do differently than they've done in the past to justify the cost of the service?
Thank you, Director Harrington. The simple answer for that is considerably more marketing work. One thing that we've heard from our board and the county commissioners is the need to increase our market presence. We have launched the Change Institute. There'll be 4 service lines there that we will be focused on. We have a considerable amount of work to be done on workforce related branding. And we are also working very hard to work with the health plan. Remember, the health plan is more than doubled in size since the last contract. So there's considerably more area that we need to cover in terms of marketing. We'll also have a specific campaign relative to redetermination coming forward. And so the simple answer is we will be doing considerably more marketing over the course of the next several years. It's not that the costs have gone up, it's that the work has increased.
Yeah. And Karen and her team have done a very good job of coming up with interesting ways to market the hospital over the course of the last several years, but we haven't been able to, because the investment into actually penetrating the everyone's hearts and minds has been limited by the amount of resources we put into it. While we have the funds now to do it, now's the time. Any follow-up, Joe?
And if I'm clear, this is a 3-year contract, is renewable each year. So we would have a report at the end of the first year that would show what's been done. We would have some actual metrics to justify the cost of the work that was being done. And we would be approving it moving forward based on that. Or if we approve it now, it's for the term of the, it's down for all 3 years. So are we approving it for 3 years, or this will be reviewed at the end of each year to continue the contract?
We're approving it for 3 years. And then 3 one-year
We're approving
options
it for
after
3 years. So the contract conceivably could be extended out to 2028. But
okay,
you know, the report, but in terms of where we're at on the work we're doing, in terms of marketing, that can, you know, I'm not sure where if there's a committee home for that, because the work is spread out across a lot of different disciplines. But I think, you know, Karen can provide an update, you know, on how we're doing in terms of marketing and her work with Race Publica, you know, either to the full board, to the finance committee, to the managed care committee, wherever it feels it's relevant. But we can, you know, we can always parachute into that and have a regular update.
Okay.
Otis?
Thank you. Director Harrington has, he's posed 2 of the 3 questions that I had in mind in terms of why the increase in the scope of work relative to scoring metrics, you know, after 1 year versus 3 years. I have a concern about approving a 3-year agreement without any definitive metrics on the front end that the board has reviewed. So that was my question. And the other question was, you mentioned the Department of, you didn't mention the Department of Public Health, but you mentioned county care. Can you elaborate on that a little bit in terms of the involvement of Department of Public Health in this marketing space?
Director Story, I think that I would yield that question to my colleagues at the Department of Public Health. At this time, you know, we pulled in the Department of Public Health on the My Shot and Trust Us campaign, but they have historically operated their marketing efforts separate and aside from the health system.
I think, yep.
And it's my understanding they
I also
RP on the street at this time.
Yeah, this is Dr. Rubin. If I can respond a little bit. We have a small RFP out. I mean, large for the health department historically, but a small RFP out for a marketing campaign, a couple of marketing campaigns, and we hope to have that come down soon. We were not aware of the Res Publica you know, expansion of their scope of work for the health system, and we were not included in that. But we have this alternative marketing RFP that's out there right now to do an SDI campaign, and then a couple of other things, related to COVID and non-COVID activities.
Okay, so
So,
Dr. we'll be seeing a
it-
separate agreement from the Department of Public Health in marketing and sales.
Yes, as soon as the RFP comes down and we can review the applications. It's posted right now.
Thank you.
Yeah, and it's not a marketing sales, but a marketing contract, and the role of public health and its functions are separate than what we do with the hospital and managed care, which are more closely aligned. The one thing I want to make sure we understand as well is that, we have people that are actively managing the contracts, and they will come back, but they're the ones measuring against the metrics until we get updates and whatnot. The board will consider how well these contracts have been managed and whether management's done a good job of hitting those metrics with the vendors, and then we consider that when we consider a new contract extension. So let's move on to the next one.
Okay, request number 18, execute a contract with CDW Government for Microsoft Office license and maintenance support services, 1.75 million FY22, 10.5 million over the next 36 months. What you have here is that we've done taken 3 contracts that was previously let and combined them into one comprehensive contract to provide for all the Microsoft Office licenses, the Microsoft Server core enrollment, Microsoft Enterprise Agreement, and maintenance support for all Microsoft products. And the vendor is a GPO vendor, one of 3 GPO vendors we have on contract.
All right.
Next, hearing no questions, next item.
Yep.
Item 19 is a contract with Neurotech LLC for neurology, clinical neurophysiology, and continuous EEG services, $533,000 for FY22, 3.2 million over the next 36-month period. We posted an RFP for this. This is a new service line. It's within the Georgia Hospital for the neuroscience service line, building a continuous EEG program at the health system, helping with the transfer of patients that keep us from transferring patients out of the health system. And the contract has 2 one-year renewal options. 20. Execute a new contract with Orkin LLC as one of 3 GPO vendors for pest control services throughout the entire health system. $75,000 FY22 impact, $440,000 for the next 36 months. And system-wide comprehensive pest control and pest infestation assessment for the system. 21 is to execute a contract with Andara Medical Inc. for aspiration guide catheters and flow retriever catheters within the Department of Cardiology, $72.5 thousand for FY22, $435,000 over the next 36 months. These are catheter supplies and disposables for our EP lab here at Georgia Hospital. 22, a new contract with IBM for IBM Pharmacy Micromedics Clinical Evidence Premium Package, $93,000 FY22, $281,000 over the next 36 months. Vendor will continue to provide software license and support for the IBM Micromedics, which is an event-based multi-database, drug search engine, and to provide summary and in-depth information for drugs. This request is sole source because the software is proprietary to IBM and IBM Watson. 23. executing a revenue generating contract with Tropical Optical Company, doing business as Tropical Optical Vision Center as an optical service provider, a 5-year agreement where we expect to generate $250,000 revenue each year to provide a wide variety and range of vision correction devices to cater individuals of all socioeconomical status in order to provide their improve their quality of life. We're talking glasses, contact lenses, specialty lenses, and low vision aids. Also, this contract will be usable by our employees if they so desire. Contract has 2 one-year renewal options. That's the end of the contracts. If there are no questions.
Yeah, just real quick, Charles. I want everybody to keep in mind that every contract has KPIs and that they have to meet, and if they don't meet them, they lose the contract, including the meeting if they meet the MBEWP requirements. So, and then I believe Israel is planning on presenting performance metrics on the media campaign in his report, and will keep us up to date on those. Anyway, Charles, I think you have next your speaking of MBE, WBE, you're going to be giving that report right now, correct?
Yes, for the month of March, and contracts that came before you for March. Looking at the second column from the far right, there was 22 contracts brought before you for $119 million. 7 of those contracts had contract-specific goals, so therefore the difference of them had 0 goals, meaning that there was nobody certified within the city or the county for that. So out of the 7, we had only one prime vendor. This is pretty low mark this time for prime vendors. Only one prime vendor for $20,000 of participation. 4 minority or women-owned business for subcontracting, 4 for a $16 million award, 15%. Unfortunately, there was 2 full waivers this month. The health plan service contract for interactive text communications with members for $250,000, garnered a full waiver, and the health information management contract with the cancer registry services for $1.3 million ended up being a full waiver. So that's the 1.5 you see here. Looking at the far right with the very last column, this is the year-to-date total for the 4 months that's starting in December 1st. 30 contracts had contract-specific goals for $259 million. 3 of those were prime awarded to prime vendors, prime minority or women-owned vendors for $4.9 million, 2%. 21 subcontractors for $55.7 million, and 21% there. So combined total between those 2 categories is 24 minority vendors for a little bit over $60 million award, and 23%. The very last line, if you look over the last 4 months, I had 6 full waivers for 7%. Next slide, Debbie. So here we see the month of March has dropped to 15%, but good thing about it is hopefully it's 1 month is not a trend, so therefore here year to date we're still trending at around approximately 23%. Any questions?
Any questions for Charles on this? Hearing none. Charles, you want to go through the 6 emergency purchases, and then after you give that report, we're going to do the combined motion, which will include the contract procurement items.
So as well, we had 6 emergency purchase was reported to Chairman Taylor as chair of the board and Chairman Wright as chair of finance during the month of April. First one was A1 Recruiting for a 12-month contract on behalf of the Department of Nursing to provide recruitment of applicants for various actively recruited positions, not to exceed $100,000. A second one was Change Healthcare Solution, a 12-month contract on behalf of pharmacy to provide a pharmacy claims management solution. This contract would have a one-year renewal option there, not to exceed $180,000. Hill Mechanical Group is a joint effort between the health systems facilities and the Cook County Department of Capital Planning and Policy. So it's a CIP funded project to provide immediate repairs and restoration of the mechanical systems at Providence Hospital, not to exceed $4.3 million as a CIP project. Independent Living Systems, LLC, 12-month contract extension to provide contract amendment to extend the contract period only. No additional funds is required. Vendor will provide for supplemental food services to county care plan members as designated by the plan. 12-month extension there with no fiscal impact. Likewise with Relay Health Pharmacy, also to provide a contract amendment to extend the contract period only. No additional funds are required. This is for pharmacy claims management, 6-month extension while we look to transition to a new solution. And then lastly, we have the contract with Slalom LLC, doing business as Slalom Consulting for CCH administration and CCDPH to provide assistance with 2 operational programs, strategic project management services for $613,000, and Department of Public Health building a healthy community initiative and COVID-19 grant administration for $2 million. Combined contract award, $2.6 million, not to exceed for a 6-month period. Any questions?
Any questions on any of the emergency purchases?
All right, hearing none, thank you very much.
Now we're going to go to the combined motion, which would be, hold on, to accept item 3A, the April 21st, 2022 Finance Committee meeting minutes, and approve item 4A, contracts and procurement items containing request number 1 through 23, subject to completion of review by contract compliance. Is there a motion?
So moved.
Second?
Second.
Motions made and properly seconded. Any discussion on the motion?
This is Director
Hearing
Herring.
none. Go ahead, Joe.
Yeah, it's not a question, it's a request, and it's still regarding the Res Publica contract. One of the milestones we got in a memo would point out how they helped us maintain and grow the health plan share through effective campaigns designed to increase brand awareness, recruitment, and retention. And I'd like to see some information that supports that contention.
Director Harrington, it's Karen Stancik. The deck that I shared with you from last month's presentation to the Managed Care Committee, I think it starts on slide 32, shows some specific numbers in terms of phone calls to the call center, clicks to the website, and all of those things all happening at the same time that we have seen growth in the health plan.
I'll go back and review it.
I'm happy to meet with you offline if you'd like.
Okay. Thank you. I appreciate that.
Any other discussion on the motion? Hearing none, will the secretary please call the roll?
Roll call on the combined motion. Aye or nay, Director Deere?
Aye.
Director Harrington?
Aye.
Director Munar?
Aye.
Director Story?
Aye.
And Chair Ryder?
Aye.
You have 5 yeas and 0 nays.
All right, thank you, everyone. Moving along, we're, Pam, are you still there? You've been hanging in?
I'm hanging in.
All right, okay. You have 3 minutes to give your report. Ready, go. No, I'm just kidding. Do you, Pam, do you want to do the, so as far as I understand, you're not presenting any transfer of funds, correct?
Correct. No transfer of funds and no grants received this month.
All right, great. You want to go ahead and give your report on the 2022 financials?
Yes. Thank you, Chair Ryder. Good morning, directors. Let me turn on my camera there. So as you can see on your screen there, for the 4 months ended March 31, we came in at a 1.2 million positive variance to budget. And on a cash basis, the county has us at a 242.5 million positive variance. The key items of mention on the revenue side, we were under budget primarily related to volumes, which we'll take a quick look at on another slide. And on the expense side, we had items that were over budget, items under budget, but overall kept our expenses contained to help offset that revenue shortfall. County Care came in at 10.1 million gain, and their membership remains better than budget. Next slide, Debbie. So here you can see the actual financial statement. Again, total revenue, 21.2 million behind budget, driven primarily by that top line net patient service revenue, which is related to volume. And then total expenses, 22.9 million under budget, bringing us to the combination of which to the 20.1 million, the budget 19, or 1.172 million over budget. Next slide, Debbie. So as we look at the volumes, inpatient is basically at budget year to date. The outpatient is still running behind budget, but better than 2021 at the same time. Also, I would draw your attention to the month of March, the right 2 columns. We did see an uptick in the outpatient ER and surgery compared to last year, which hopefully is an indication now that COVID has subsided and the weather is getting better, that our outpatient volumes are coming back. Next slide, Debbie. And this slide as well, you can clearly see the slow climb back, upward trend over the last 4 years. Some the volumes almost to 2019 levels and some not quite there, but definitely an upward trend over the last 4 years. Next slide. Our payer mix, consistent with prior months, nothing specific to mention here. We remain over 90% Medicare, Medicaid, and uncompensated, whether you look at it in terms of charges or encounters. Next slide. So revenue cycle. Revenue cycle is all in the green this month, meeting their KPIs. One of the key things to point out this month is that we added at the bottom there, and I don't know if you can scroll up just a tiny bit, Debbie, case mix index. And case mix index, we measure both just looking at just Medicare and then all other payers, and it reflects a combination of patient acuity, but also coding and documentation accuracy, which impacts reimbursement. And so we're adding it here, and we'll continue to trend it and watch it over time. Next slide, Debbie. And on the denials as well, we continue to run in the yellow in terms of total dollars, but we continue to do better with the post improvement line, the bottom orange line there. And we added another graph as well this month. We added the performance to industry target, which is to be below 2% of actual cash collections, and we are meeting that goal. Next slide. Related to our charitable and public program expenditures. Dr. Guggenheim, did you have a question? No? Okay. Related to the charitable and public program expenditures, we are projecting at this point in the year to actually come in less than we budgeted and less than prior years, but that is strictly a function of the lower volumes we've seen so far this year, which means lower dollars written off at this point. Next slide. Our savings initiatives, both on the revenue cycle and on the expense side, both on target at 4/12 of goal. And next slide. County care, as I mentioned, 10.1 million. Their budget was actually 11.7, so a little behind budget at this point. Their total costs are higher than budget due to the higher membership, but are at budget on a PMPM basis, but their revenue per member per month is lower than budget due to their current population mix. And then again, the graph at the bottom, just to make mention that, you know, the public health emergency was extended to July, now October. So membership should remain higher than budget, which will help to maintain their financial performance. And then lastly, more care, slightly worse than their budget. And as commented in the box, their membership is lower, their loss is a little higher. And as you know, we'll be wrapping this up and exiting at the end of the year. And I will open it up for questions for either myself or Chief Revenue Officer Curtis Haley is also on the line, as well as Aaron Galiner, Chief Interim CEO of County Care, if there are any follow-up questions.
Any follow-up questions for Pam or her team? For Curtis or Aaron? All right.
Thank you.
Thanks, Pam. Thanks, Pam. All right. I believe we have one more thing on the agenda, and that's an update on the Vizient contract for contract management and nursing registry services. And I believe Bina and Charles are going to be presenting on that. Am I correct?
Yes. That is correct, Chair Ryder. Good morning, directors. I am here to provide a 6 months update along with Mr. Jones on the VIA contract, previously known as Vizient contract. Next slide, please. The updates include the contract scopes, contract implementation and the benefits, a summary of the agency usage for FY21, and also FY22 first quarter, current agency recruitment challenges, and also county recognized the MBE/WB usage. Next slide, please. So the VIA contract scope is due to support the nursing staffing due to vacancies as well as the COVID staffing needs. And this contract provide all the nursing labor support to the entire system. And when I say nursing, that include RNs, nursing assistants, MAs, and other staff to support the operation of the nursing, and also to provide the safe and quality care while we are recruiting nursing staff to fill the vacancies. Next slide, please. So from a benefits perspective, we implemented this contract in December 2020, just prior to the COVID resurgence. Since then, since we had this contract, the overall staffing needs increased by 400% due to COVID staffing needs, as well as to cover the vacancies. The number of agencies, the pool expanded from 6 to 49 through VIAS or Vizient. And also overall agency fill rate increased from 30% to 90% with this contract. And FY VIA provided over approximately 173 FTEs to cover the nursing vacancies while we are recruiting. And also the process, the centralized contract process helped us to really streamline the invoicing process. And we used to have over 20 invoices, different agencies in a week. Now it's streamlined to 5 through this particular contract. And also via this VIA/Vizient contract, extended our capability to, onboard more nurses, not only within Illinois, but also across the country. More than 50% of the agencies, came from outside of Illinois when we needed them to manage the COVID surge. As of today, in FY22, we onboarded over 1,500 agencies through VIA, and this number is a big number because the agency turnover for the past 1 year is significant. The nurses only gave us 8 to 10 weeks, or some of them 6 weeks of contract, because people are moving between state based on the staffing needs. So we also ensured that all qualified agency staff provided by MBE, WBE vendors are accepted 100%. Next slide, please. So just to a high-level overview of FY21 4-quarter summary, the agencies were used to manage vacancy and also support some of the COVID efforts, which include the vaccination. So you could see that 24 FTEs were supporting the vaccination efforts, and the 173 to backfill the vacancies, and also number of FTE staff were increased to support the increased COVID staffing needs. Next slide, please. This is the summary of FY22 Q1. Currently, B Nursing has over 800 vacancies. This is not just RNs, all support services within nursing. And we are using 391 VIA agency staff to cover the gap, while we are working with HR to recruit the staffing to fill the positions. Next slide, please. So there are, significant challenges also in nursing recruitment as well as the agency. Those are related to significant increase in staffing needs due to COVID that include vaccinations. Across the nation, increased nursing demand and a gap, which is vacancy, and also high agency turnover, because that also create quite a bit of challenges for the health system to onboard, as well as to make sure that the agency nurses are competent and to provide safe quality care. Increased demand of travel nursing across the country is actually many nursing staff, especially younger generations, are leaving the health system to the attractive travel package. And this is not just here at Cook County, we are seeing the phenomena across the country. And also, again, highly attractive compensation package for agency staff. At the national level, we are projected to have over 1 million nursing shortage coming years, and also overall nursing turnover is around 23%, which is an increase from 19.6% from 2022. Nursing workforce is nearing retirement. That is, average age of a nurse at United States is 54 years. Cook County, yes, ours is 52. So we are also in line with what's happening across the country. Next slide, please. So I'm going to turn the presentation back to Mr. Jones to go through the VIA vendors as well as the MBUWE benefits.
Yeah, thank you, Dr. Peters. So prior to moving to the contract labor management methodology for contracting, we had individual contracts with vendors. Of the 6 that Dr. Peters spoke of earlier, three of those vendors were minority and women-owned vendors that were certified that served with us as a prime. And one of the vendors was a GPO vendor that also had subcontracting participation. So here with this slide, what I'd like for you to pull from it is that now that even though we have a little bit less than 50 vendors to choose from for resources, we were able to maintain and retain those minority vendors for participation here. Those highlighted in yellow are certified county MWBEs. We had the 3 that we had before, and now we were able to pick up a 4th one for this contract. Next slide, Beener. And with that being said, the hours of diversity participation, these are the 4 vendors listed that are county and city certified MWBEs. In December 2020, we started off kind of slow with 8,151 hours of participation. And by the next quarter, we were able to triple it. And since then, pretty much maintained those hours of participation throughout February of 2022. Back to you, Dr. Peters.
Thank you, Mr. Jones. So I also wanted to share a couple of slides on what is happening with the market rate, agency nursing market rate. When we started this contract, average rate was $70 an hour. In the midst of COVID, the rate increased all the way up to $205 an hour, which is 192% increase. And if you see the market is coming down, the average rate was for the first quarter of FY22 was around $170. And also the similar trend was noticed within the nursing support staff. There was an overall 76% increase, and also the rate is coming down. So we watched the market rate on a weekly basis and adjusted with the vendor. Next slide, please. This is a sample of R&B, rate, between quarters or between months, actually, based on the demand and the COVID staffing needs. During the month of 2022 March, we saw the peak rate, and in April it came down, and also it's May. So we are adjusting the rate on a bi-weekly basis in collaboration with Mr. Jones to make sure that the market trend is reflected in what we are, paying for our vendors. So. Next slide. No, thank you so much. This is an overall update, 6 months update for the VIA contract. Any questions or comments?
The only thing that I'm reflecting on right now is on the actual hiring of permanent nurses and making sure that we're doing things that allow us to remain competitive with the competition we're getting from Registry. Obviously, permanent employment is, probably measured differently. There's different benefits you get. The financial package, in the overall is better, but people are looking at that hourly rate flexibility when they're considering it too. So I think that that's not what you're reporting on right now, but I think that we just have to make sure that as we get this data, and I'm sure you guys are doing this, making sure that it's translatable to what we're doing on the hiring side too, to so that way we are able to bring permanent folks in and also make sure that we're doing the things to retain our current workforce, keep them away from transitioning to Registry, because they're seeing other opportunities there. So.
Chair Ryder, I totally agree with you, and we, both the HR and nursing and across all the executive in the system, including Mr. Rocha, are coming up creative plan as well as a retention plan. What do we need to do? We established a retention committee, hearing the voice of nursing, frontline nurses. So there are a number of activities are happening within, and I'm going to provide a nursing update in the next one of the meeting. I believe the quality and the retention efforts will be part of it too. So Ms. Amos, would you like to add to the efforts? We are working every day.
So thank you, Dr. Peters and Chair Ryder. This is Valerie Amos, Chief Human Resources Officer. Absolutely, our team, Chair Ryder, has been committed to, defining what kind of system-wide recruitment and retention strategies we should have in place. We certainly understand that the market is quite competitive, and we are looking for creative ways to address our staffing gaps, because we realize that agency costs really do need to decrease. So we have plans in place for that, but thank you so much for acknowledging, and we appreciate your continued support.
All right. Does anybody else have any questions? We're running into Mary's meeting right now, so hearing no questions. Thank you, Bina. Thank you, Charles. We've exhausted the agenda, so we're adjourned. Thank you, everyone.
Thank you.
Thank you.